If you have just completed NEET UG and thinking of taking BDS as your career option, but don't know what the course actually offers, what will you be doing, what will you be learning, and how your future professional life look like, then this video is for you. Hello everyone, I am Dr. Vrishali and today I am going to tell you everything that you need to know before joining BDS. BDS is Bachelor of Dental Surgery. It is a 5-year undergraduate medical course that will specialize you in becoming a dental surgeon. Yes, a doctor who will be treating dental and oral conditions. You all must have already googled what is BDS and what all will you learn in that. But today let us go deeply into it and understand what the course actually offers. Most of us have a misconception that dentists only study about teeth and they only know how to fix teeth and nothing more than that. But that's not true. Starting from first year till final year, we study everything that we need to know about the human body. So even though we specialize in teeth and oral cavity, we will have the knowledge about the whole human body. The first 3 years we have the same subject as that of the MBBS student, starting from the first year where you will study human anatomy, human physiology, biochemistry and dental anatomy and dental histology. This year builds the foundation of medical subject and introduces you to teeth anatomy. So in this year you will basically understand how a human body is, like all the normal things, because before knowing what is abnormal you need to know what is normal. So you will learn everything from how a life starts to how a human body works. In second year, you will study pathology, microbiology, pharmacology and dental materials. Along with this, you will be also introduced to preclinical conservative dentistry and preclinical prosthodontics. So in this year, you will understand how a disease is caused and what are the reasons that causes a particular disease. You will study about microorganisms and you will study which are the medicines, like basic of medicines, how it will work in your body and everything that you need to know about medicines. Along with this, you will be introduced to hand-on dentistry, where in preclinical labs, you will learn the skills that will be very useful and much needed skills in your clinical dentistry. So this is the basic foundation for knowing a particular disease and building your hand-on skills. And in the third year, the real game begins. You will have general medicine, general surgery and oral pathology. General medicine and general surgery are the huge and main medical subject, and oral pathology, it is the foundation of dentistry, and also your clinical posting starts. So you will face the real patient, you will learn patient communication, you will learn how to handle the cases, and all the hand-on clinical dentistry starts here. And you may be confused, why do we need these medical subjects? This is because your oral cavity is connected to your whole body, and if you are dealing with oral health, overall health matters in a very big way. Now comes the final year, Sabka Baap. Here you will have 8 subjects starting with oral medicine and radiology, prosthodontics, oral and maxillofacial surgery, public health dentistry, pedodontics, periodontology, orthodontics, endodontics and conservative dentistry. This year will be extensive, juggling between the assignments, completing your quotas, managing the patients and studying for your final exam. Here's where everything falls into place. Next is the 5th year, the internship. This is the perfect blend for learning your clinical skills and enjoying your college life. Here you will have the clinical posting rounds covering all the 9 departments for the duration of 365 days. In this, you will be posted in every department where you will learn about the particular department in depth, and this is the year where you will come to know if you are interested or aligned toward a particular department and if you should go for MDS or no. Along with this, you will enjoy your college life to the maximum. All the masti mazak in the department, going to the trips and finally getting graduated. So this covers a loop of 5 years of your BDS. Yes, dentistry is a demanding course, but it is one of those few career options where you can be your own boss. You will learn hand skill, diagnosis, patient management, communication skill and a lot of human science. But it also teaches you patience, a lot of patience. Because if you think BDS is only about studying and studying, it is not the case. In dentistry, hand skills matters a lot. So if you want to be a good dentist, then hand skills is must. So now we got to know what we study in BDS. But what after that? What are the career options that you can explore after BDS? And what is the actual career scope? Let's understand. First is clinical practice. If your final goal is to start up a clinic and you like clinical dentistry, then this is your choice. You can start your own clinic or can be an associate dentist, which means that working in someone else's clinic. If you open up your own clinic, the earning potential is to its maximum. It depends on many factors such as location of the clinic, how is your handwork, how is your patient communication skill, and initially you may have to invest a few lakhs for starting the clinic, but once you get a grip on it, there is no limit to your earning. You can start with around 80-90,000 in the starting of your clinic, and it can go up to lakhs together in future days. So if you are starting up your clinic, you may need to get little exposure on how to manage the clinic, how to have those good communication skill, because it differs from what they have taught you in the college and what will be going on in the private practice. So you may have to learn the communication skills, you will have to learn how to manage the clinic, what all materials to buy, how to do all the things. So this is during the initial phase of your career. The pay as an associate dentist is very less. It starts from around 10,000 and goes up to 25 to 30,000 for maximum, and most of us don't stick to this because it is not a stable job, and we will be working under someone else, and the main thing, the pay is not good. So this is during the initial learning phase. After this, you can go and start up your own clinic. And the one main question everyone has, is it really necessary to do masters if your end goal is to start your own practice? Then I would say no, because I have seen many dentists who are just BDS graduate and their clinics are running like really amazing. But if you do MDS, it will definitely add up your knowledge, your skills, and you will have a higher knowledge in that particular specialization. The second option is MDS. MDS is Masters in Dental Surgery. So here are 9 specializations that you can get your MDS degree from, starting from orthodontics. This is a specialization in braces where the orthodontists deal with here you will learn the diagnosis and treatment of misalignment of the teeth and the jaw by using braces, aligners, and other orthopedic appliances to improve bite and facial aesthetics. Second specialization is oral and maxillofacial surgery. This is the bridge between BDS and MBBS. Here you will be a full-fledged surgeon doing surgeries related to face, jaw, aesthetic, cancer, trauma, and everything related to head and neck. Next is prosthodontics. Here you will be skilled in replacing the missed tooth with crowns, bridge, dentures, and implants, restoring both the function and smile. Next is conservative dentistry and endodontics. Here you will specialize in saving a tooth which is decayed, broken, and infected using fillings and root canals. Also, you will specialize in smile designing by using veneers, teeth whitening, which is really booming nowadays. Fifth is periodontology. Here you will become an expert in diagnosing, treating, and preventing disease related to gums, and you will also learn doing flap surgeries. Next is oral medicine and radiology. Here you will become an expert in diagnosing disease and managing it clinically, and also you will be an expert in interpreting CBCT, MRI of head and neck. Next is oral and maxillofacial pathology and microbiology. Here you will study disease affecting mouth and jaw under microscope and help diagnose cancer, cyst, and other lesions by studying it histopathologically. Next is pedodontics and preventive dentistry. Here you will be a child expert where you will be learning how to prevent, diagnose, and treat disease related in children, and also you will learn the behavior management and growth and development from infancy to adolescence. Ninth and the last one is public health dentistry, where you will focus on improving oral health at an community level through research, policy making, and educating people in mass about oral health. After completing MDS, you can open up your own clinic. Apart from this, you can also go for consultation in the particular category that you are specialized in to different clinics, so that it will increase your earning potential. So starting from few thousands, you can earn up to lakh with the MDS specialization, and there is really no limit from running your own clinic to going for consultation. Along with this, you can also be an teaching staff at dental college. So coming to the third career option, teaching. So you can go into teaching and academics if you are really fond of teaching students and sharing your knowledge, or in research. So being an MDS graduate, your earning can start somewhere from 40 to 50,000, and with experience it will go up to lakhs if you become a professor or HOD. Next is government sector job. You can apply as a dental surgeon, government hospitals, in public health centers, in Indian Railway, in Army Dental Corps, and much more. Here the salary varies from around 60,000 to 1.2 lakhs, including the benefits and job security. Next is abroad opportunities. You can write licensing exam for USA, UK, Australia, and practice where dentistry is much more valued, and here you can earn up to 5 to 10 lakhs per month easily, depending on the country, license, and your experience. Next is corporate or entrepreneurial job. Here you can come to the non-clinical sector of dentistry, where there are many options which you can explore, where you can go into hospital and healthcare administration, medical coding and content writing, medical and dental journalism, clinical research and regulatory affairs, and dental product managing and marketing. So yes, BDS has hope. But like any other profession, it completely depends on you. Because the most common question that we have is, isn't BDS saturated? Is it really worth it to do BDS? My answer is definitely yes, because saturation is in every field. Whatever field you go, there is saturation. But you think as a patient, if you want to go to a dermatologist in your city, what will you do? You just go on Google, you search for the best dermatologist in the city, and you will get the names, and you will go to someone who is really good. So the same thing is with dentistry. If you are good in what you are doing, and if you are really confident that you will succeed, then you can make your own place in whatever field you go. So there is no such thing as saturation. It completely depends on us as how we will carve a future and how we will make path for ourselves. All that you need is to be consistent, to work hard and give your 100%. I hope this video really helped you, and if you thought that this video was worth it, do like it and also share with your NEET UG friends who want to explore this option.